So we've been called to a 22-year-old female who's been playing netball when a ball hit her face to the left side of the nose, and her nose just won't stop bleeding. On examination, we've cleared her C-spine. There's no concussion symptoms. She remembers the whole incident, and the bleeding hasn't been able to stop for the last 40 minutes. So this patient has moderate to severe epistaxis, and we're going to treat it with intranasal adrenaline. So for the adrenaline treatment, we've got our equipment that we need. Okay, so I'm going to do a drug check here. I'm just going to look at the date here. I'm going to get my off-sider to do a drug check for me. And while she's doing that, I'm going to draw up the saline.
Adrenaline 1 mg in 1 ml, expiry date 7/2018.
Perfect, thank you. Okay, so we're just drawing up 9 mils of saline to 1 mg of the adrenaline. That on there. Cool. And we'll pop open the adrenaline there. Cool. Yeah. Get it all nice and mixed up. So I'm just going to get my off-sider to check that there is 10 mils in here. And can you pass me a 3 ml syringe, please?
Yeah, sure. So there's 10 mils in there, and
perfect.
here is a 3 ml syringe for you.
Cheers. Alright, so I'm just going to shut that. So I'm going to swap this over here. We just need to draw up 2 mils of adrenaline into a 3 ml syringe. Which is the dose for an adult. So I'm going to get my off-sider to label that for me. And double check that there's 2 mils in there.
Yep, that's 2 mils in there.
Perfect. Alright. So this now goes into the shots container, and we're going to put the mucosal atomized.
And I've labelled that as adrenaline for you.
Perfect, great, thank you. Alright, and then we've got 2 mils here ready to be administered intranasally. Her left nostril is still bleeding, so we're going to use the adrenaline. Okay, so Lucy, what's going to happen is that this device is going to go up your left nostril, and on the count of 3, 1, 2, 3, sniff, and then I'll push the adrenaline up the nose, and hopefully this will stop. Is that okay?
Yeah, that's fine.
Perfect. Okay, so blow your nose first. Blow out all the clots. Okay, perfect. Great. Alright, so just up here, and on the count of 3, 1, 2, 3. Great. Perfect. Okay, so apply another 15-minute compression, and we'll see what happens after that. Okay. Okay. So Lucy, what we'll do while you're doing the 15-minute compression there, we'll get you to sit forward. Okay. Okay. Yep. Any blood clots that you get in the back of your throat, spit them out into the emesis bag here rather than swallowing it, because that can cause vomiting, which can be a bit yuck. Yeah. If this 15-minute compression doesn't work and it's still bleeding, we can put an ice pack to the back of your neck, which will cause vasoconstriction, which will help reduce the blood flow. Okay, and we can do one more dose of the adrenaline as well. If it's still bleeding after that, we will need to take you through to the ED. Okay?
Yeah.
So Lucy, how's that bleeding going? Is that stopped yet?
Yeah, I think it has stopped, yeah.
Perfect. Oh,
Yeah.
that's good. Okay, so what I think we'll do is we'll leave you at home because you're not taking any anticoagulants, which is good. My advice to you is that you take that you avoid taking hot showers and having hot drinks, and also avoid blowing your nose for as long as you possibly can, which will help prevent the bleeding from happening again. I'm going to document everything on my EPRF, which is a report that we do, and I'll fill out a form for you to have, and we'll give you some advice about what we've just been speaking about, and also there's a number on the back of it that you can go online and view what we've written on our report. Okay? If you have any further concerns or the bleeding starts happening again, I advise that you go see your GP and hopefully they can sort something out for you. Okay?
Okay.
Great.
We've been called to a 20-year-old female today who's been complaining of a unilateral headache. So she's experiencing some head pain on the left-hand side of her head, predominantly over the left eye. She is nauseous, but she has not been vomiting, and this is a normal presentation for her. She's not got any allergies, and she doesn't take any regular medications. Okay, so she's suffering from recurrent migraines. She doesn't have a history of any intracranial bleeding, and there's no family history of any cerebral vascular abnormalities. She's not had any previous neck manipulations, and she's also not experienced any trauma, serious illness or injury. So today she experienced flickery vision, and then the headache came on gradually from there, and she is not pregnant. Nothing makes the pain better or worse. It's a dull pain, and it's throbbing on the left side over the left eye. It doesn't radiate anywhere, and the pain she is experiencing is at a 5 out of 10. So I've assessed Anna here as a GCS of 15. She hasn't experienced any loss of consciousness or altered consciousness, and no history of this either. There's no coryzal symptoms, and it did not come on during sexual activity. There's no photophobia or phonophobia. So I've got my offsider to take some vitals for me, and these have all come back with the normal ranges. Okay, so I'm going to check her hydration status. And can you stick your tongue out for me? I'm now going to do a fast test. So just having a look at the face, I don't see any unilateral weakness or facial drooping. Can you smile for me? Okay, and that's all even. And can you hold your arms out, palms up in front of you? Okay, and close your eyes, and you're going to hold them there for 10 seconds. Okay, all right, you can pop your arms down. And can you please say it's a very sunny day today?
It's a very sunny day today.
All right, so there's no slowing of the speech or any abnormalities in that, so that's negative. I'm just going to click on each of your ears. Can you hear that equally both sides?
Yes.
And can you feel me touching you the same on each side?
Yes.
And do you have any tingling sensations?
No.
Everything feeling normal for your presentations of migraines?
Yes.
Okay, if you could just follow my finger with your eyes without moving your head. Okay, so we've got equal tracking there. Have a feel of your head, is that alright? Any increased pain when I touch here?
No.
No. Okay, alright. And can you please raise your eyebrows for me? Okay, alright, so we've got equal movement there. So this assessment here shows that there is no obvious cranial nerve involvement. I'm just going to have a feel of your neck, so just palpating the C-spine here. Any tenderness or pain?
No.
No. And if you can turn your head side to side. Any pain, stiffness?
No.
And if you can touch your chin to your chest.
Yeah.
Any stiffness or discomfort there? No pain? Okay. I'm going to be administering some analgesics and antiemetics to my patient. So have you taken anything in the last 4 hours?
No.
And I'm just confirming you've got no allergies to anything
No
at all?
allergies.
Okay. So I'm going to be administering paracetamol, ibuprofen, tramadol and ondansetron. So can I just ask, are you above or below 80 kgs?
Below.
So I'm going to get my offsider to drug check these for me. So I'm just going to have a read of them. And if you can just read those out to me with their expiry dates.
Ibuprofen 200 milligrams. and expires 1st of 2019.
Yeah.
And paracetamol 500 milligrams expires the 1st of 2020. 4 milligrams of ondansetron and it expires 2018. And tramadol 50 milligrams expires 2019.
Okay, great. Thank you very much for that. So we're going to give you your 2 ondansetron tablets, 1 tramadol, 2 paracetamols, and 2 ibuprofens. And with all the assessments we've done today, there doesn't seem to be an underlying cause for the headache, so a migraine is a primary headache. Okay, so you're known to have migraines and it's normal for you to present like this. But if you call back, if you get any severe pain at all, if you're severely vomiting, or if you're unable to mobilise, I want you to call us back. You can also see your GP as well in the next few days, and I'd advise you do that just to discuss with them a treatment plan and to get some ongoing migraine prophylaxis. And I also would advise you to get someone to go out and buy some pain relief for you, buy some paracetamol and ibuprofen, and then you can take it within the next 4 to 6 hours will be your next dose. So we're going to thoroughly document everything on our EPRF, give Anna an ACS form with the access number written on it, and I'm going to explain to her how to access this and that she can take this to her doctor to get a review. I'm also going to just go through my red flags. There's no neck pain following manipulation, there's no neck stiffness or pain, it wasn't a sudden onset, her temperature is okay, there's no vomiting, no focal neurological signs, no loss of consciousness or a history of this, no trauma, she's not taken an anticoagulant, she's got no bleeding disorder, no signs of temporal arteritis, she's not pregnant, no intracranial bleeding or cerebral vascular abnormalities, and it was not onset during sexual activity. There's no indication of sinusitis, and her symptoms are normal for her. So I could, if she was dehydrated or she'd been vomiting, I could administer up to 1 litre of IV fluids and still leave her at home if there was no red flags present.
We've been called to Rebecca. She's a 23-year-old female who's had a syncope, which is a transient loss of consciousness. So what actually happened before you had this episode?
I was at the parade and I'd been standing for quite a long time and I became all hot and then I fainted.
Okay, so you felt quite hot and sweaty, and I was talking to the bystander before and she said that Rebecca became quite pale. She collapsed onto the floor, she didn't hit her head or anything like that, and she didn't have any abnormal movements during which could suggest she's had a seizure. So did you feel confused after it had happened?
No.
Okay. And how long did it last?
About 30 seconds.
Okay. And I obviously see you haven't hit your head or anything like that.
No.
Do you have any pain down your neck at all?
No.
And you were able to mobilise into this room from
Yes.
outside?
Yeah.
Okay. Could you poke out your tongue for me? We're just checking to see if she's bitten down on her tongue from having a seizure. So what I'm going to do, we've done a 12 lead and this has come back with normal sinus rhythm to rule out any cardiovascular causes. Now what I want to do, Rebecca, is I'm going to do a blood pressure just sitting down, so if you could just relax your arm down straight. And then what we'll do is we'll get her to stand up and do another blood pressure to rule out any postural hypertension. Alright, so that's come back normal. And so what I want you to do now, Rebecca, is just stand up for me. And then we'll do another one. Awesome. So there hasn't been any big changes. There hasn't been a change of 20. So do you have any medical history? So does your family have any history of sudden death, congenital heart disease, valvular disease, or postural hypertension or heart failure? Any of those?
No,
Okay.
none of those.
And do you have a headache at all at the moment?
No.
And do you, is there any chance that you could be pregnant?
No.
Okay. So just going through my flags now, we have no abnormal vital signs. She's recovered to her normal self. We've done a 12 lead and that's come back normal. There's no shortness of breath. There's no clinically significant injury. It hasn't occurred when she's been exerting herself. She's not pregnant. She doesn't have a headache and she doesn't have a valvular or congenital heart disease. So those are our red flags, so we have none of those. Orange flags, she's over 16 years old. She doesn't have postural hypotension. She doesn't have any family history of sudden death. And also she doesn't have a history of heart failure. So we can actually put her into the green flag category as it's a clearly benign incident and it can be caused by postural or prolonged standing, as well as anything like paradromal symptoms such as your feeling of hot or feeling sweaty. So what I'm going to do, Rebecca, is I'm going to leave you at home, okay?
Okay.
I feel happy that this is just one episode. However, if it were to happen again, call us back or go to your GP to have it investigated.
Yeah.
What I'm going to do is I'm just going to fill out my EPRF paperwork and give you a ACS form which you can access online.
Okay.
And see what we've written. So all it's going to say is that I've referred you to the GP if anything like this happens again.
Okay.
And if you develop any pain, headaches, or don't feel like your normal self, call the ambulance back or go and visit your GP, okay?
Sure. Thank you.